So I'm a predoctoral student at the PCB, also within the project that Cristina just presented. And what also as a neuroplasticity is how patients are able to adapt and maintain cognitive abilities such as language after the appearance of a low-grade glioma. In this case, we are talking about language and just focusing on tumors of the left hemisphere. And the thing is that we know because we have seen it, and there are studies about the compensation and functional and structural changes separately. We have seen that functionally, some other regions are recruited that were not recruited before the surgery, and also structurally because changes in the volume has been observed, but no study has done it combining the two of them in the same sample of patients longitudinally. So that is what we want to do. And how are we going to do this? As Cristina just explained, the pre-surgical project at the PCBL is a long project, and we collected data before surgery and after surgery. And among all the tasks that the patients complete, we have the sentence completion task. That is what we use in clinical settings, and that task is also completed during surgery to map the eloquent areas. So we're going to use the data from this task to assess the functional activity. And for this functional activity, we are going to use the estimation of the ball signal. And what we see here on the right is the map for these activation patterns for 5 patients. And what we see is that before the surgery, some regions were recruited for this speech production task, and after surgery, more regions of the right hemisphere are also participating in this task. So there's a shift of lateralization to the right, or at least more bilateral. We also computed the laterality index to see in each of the regions how much of engagement there is from each one of the hemispheres with the formula that you see on the screen. And here I want to show you a little bit more of how it can look. Here we have only the representation of one of the patients, and as you will know probably, there's a huge variability among them, so we compute this for each one of them separately. And what we have on the left is also the same. Before the surgery, there are some regions that are recruited, and after surgery, the activation is more bilateral and more to the right. And what we see on the right is a representation of the laterality index, moving from the inner circle to the outer circle. It goes more to left lateralization, and moving from the outer circle to the middle circle goes to more right lateralization. We also expect these changes in the functional activations to be accompanied or supported by changes in the structural measures. In this case, we expect to observe changes in the gray matter volume in the regions that are known to observe language production and comprehensions. We are the ones that we see there on the figure. And we also expect to see those changes in their contralateral volumes. Yeah, we computed this with box-based morphometry and using the VLL atlas from gray matter. And what we expect to see from here and how we're going to use this information is pre-surgically, it's going to help us to inform the neurosurgeons about the neuroanatomical substrate that we know that is already going through changes. And after the surgery, it will give us a lot of information about all the regions that are participating or changing and that are needed to sustain those abilities in the long term. So that is all, and if you have any questions, feel free to contact me at any time. Thank you.